We begin our study of the lymphatic system, and what we need to know schematically is that the lymph system is a one-cycle system that supports the two-cycle cardiovascular system. And so you see that the collection of lymph from pulmonary circulation, from the general circulation, move into the right side of the heart via the superior vena cava. Lymph is tissue fluid. It's fluid that's outside of the vascular system. Tissue fluid, lymph are synonyms. And we can live with a faulty lymph system, but if we have a faulty lymph system, the quality of life will be challenged. 10% of fluid is dispersed arterially. That gets drained ultimately by the lymphatic system. So there's collection of lymph throughout the body. General circulation takes oxygenated blood out of the heart. 90% of the return of deoxygenated fluid. Well, maybe I'm chasing my tail on that, but the fluid component that moves into the interstitial spaces is brought back to the central vascular system. And you know that the lymph vessels are very thin, translucent, and they move to drainage or the lymph nodes for fighting bacteria and other fungus and there are some larger lymph vessels in the core of the body, and so lymph is returned to the central vascular system. How it's collected is available to you on this schematic, posted on E-Class. I think it's a worthwhile thing to walk through how do the collecting vessels then move the lymph into the larger lymph vessels, and then in volume return it to centrovascular. Here's another helpful aid in terms of the efferents and afferents associated with collection. The lymph capillaries receive fluid. The lymph capillaries receive this fluid and move toward the heart. The collectors that represented in a different schematic, these vessels, like veins, have valves that once the fluid moves through this, the valves close so there's not backwash there. And then here's an indication that it drains into the superior vena cava. Major part of the health of our intestinal tract is the lymphatic drainage in the gut. Way important for maintenance of homeostasis. And then lymphatic drainage of the breast in both males and females. These happen to be female illustrations. And so the lymph drainage in the entirety of the anterior chest sometimes goes to lymph nodes on, axillary lymph nodes, and then more central or mediastinal lymph nodes. The language of lymphatic pathology, lymphedema is edema that is sitting locally and not being drained. And we'll talk more about this in class, but I would like you to look at these YouTube videos to help you understand a couple of different cases. This particular person had 6 weeks of treatment. This is not looking good. This is lymphedema. There's just a large volume of lymph sitting locally, and you can see that there's erythema, and we're concerned about ulceration here, which leads to secondary bacterial infection. 6 weeks of lymphatic drainage, manual and also pump and compression wraps, and this left leg got way better as a result of that treatment. Now, that doesn't mean it's long-term correction of the problem, but in the immediate it can help. Here are stages of lymphedema. You can obviously see that stage 1, there's a considerable volume of lymph in these legs, and then this, you can imagine, this is very difficult in terms of quality of life threat. And then this is 3rd degree lymphedema. That's a result of elephantiasis. There's a worm that gets into the lymphatic vessels from a vector, from a mosquito bite. It takes 10 years for that lymph system to get so clogged. This is actually this man carrying his stomach over his right arm, and this is his calf, and this is his quad. Wow. And it's not correctable. So yeah. And then these are cases of lymphedema. I want you to be alert to Stemmer's sign. Doing a pinch at the dorsum of the 2nd toe. If you get a fold, then it's 2nd degree. If you can't pinch it up, there's so much fluid you can't get a fold, that's a 3rd degree lymphedema. And then you're way familiar with this, pitting edema. You got it. Another way, a way to quantify how much excess fluid is in the body part is to use a volumeter, where measure out a volume of water. You put it in this graduated cylinder, put it in here, and then measure how much fluid drains out. You put this cup here and determine. You do the unaffected side and then you do the affected side. This is actually for lower extremity. This is for upper extremity. And then treatments for lymphedema. And I want to underscore are these things the cure? These are compression. These are moving lymph fluid superiorly toward the heart to promote drainage. And so manual drainage, that is effleurage massage from inferior to superior. Extremity manipulation, so Trendelenburg's position, I'll show you in just a second. Compression garments, these would be stockingettes that would go from right at the MTP joints, right where the toes join the foot, all the way to mid-thigh or slightly above that. And then exercise, direct exercise, you activate the muscle pump of veins and lymphatic vessels if you move, okay? And doing a home program of doing that. If there's threat of infection because the circulation and the lymph are static, it's called stasis, and bacteria loves that warm, liquidy, dark environment, and bacteria can proliferate there and cause infection. And then compression pumps that move distal to proximal, so it's this effect, boom, 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 okay, moving that fluid superiorly. Now, there's a condition. I've got this underlined to make our point. It looks like lymphedema, but actually it's lipedema. It's a genetic predisposition to store fat in the legs. And how you know this is lipedema is the feet are not affected. It's like there's a demarcation here, and we're not going to put any more fat here, and we're not going to make this big edematose circumstance. This is very difficult. This is very challenging because the person's just carrying so much weight here, and it's a cosmetic challenge as well. I think some of you are aware of used to be called kinesio tape, and there are some other brand names for this now. The question is, one of the selling points for this is that it promotes lymphatic drainage. This is used quite a bit as a proprioceptive stimulator, obviously not the same concept as taping with adhesive tape to replicate the function of stabilizing structures. That's probably another discussion for us, but you can make a case that by putting this tape on, you move the dermis, it's just very, very slightly, and it can open up lymphatic collecting capillaries and promote lymphatic drainage. I promised you, and I'm not going to read all of these to you or defend all of these, but because we talked about the Trendelenburg position, yeah, somebody who has lymphedema in the lower extremities, getting him into this position really lets gravity help drain that. And these various positions. This is a time for us to just show you these different positions. These are available to you in the PowerPoint. And then back to language of the lymphatic system. I want you to know the difference between lymphadenitis and lymphadenopathy. Lymphadenopathy is enlarged lymph nodes. Lymphadenitis, well, there you go. The suffix tells you what it is. It's an inflammation of the lymph. So it's infected, it's inflamed. It could be mechanical irritation. The body's responding to the irritation by inflaming. Something that affects the lymph system and is very fascinating, very tragic in some ways, but it's onchocerciasis, and it's a worm that gets passed from this mosquito vector onto this person, and you can track this through its course, where the parasite lays a larva under the skin, and it results in these changes, not unlike the filariasis of elephantiasis. And then when the vessels, the lymphatic vessels, become inflamed, it's called lymphangitis. Here's a darkly pigmented person, and you can track these veins, these red veins, lymphatic vessels superiorly. And then lymphangiectasia. Lymphangiectasia is inflammation of the lymphatic vessels in the eye. As a matter of fact, I'm not going to be specific to the eye. It's not just the eye. It can be on your skin, called spider hemangiomas, or lymphangiectasia of the skin. And then the various organs, I've shown this to you before, but the organs of the lymph system includes tonsils and adenoids, and then here's an example of some pretty serious tonsils. So know that these chains of lymph nodes that are in this mid-sagittal line, and where these are, and then certainly the thymus we talked about that gets small with age. We've talked previously about melanoma and sentinel nodes and the lymph chain. Here's another example. The cancer's here. Here's the sentinel node, and it can metastasize. That's what we wanted to cover on the lymph system. Be students of the lymph system. Bye-bye.